If you are over 60 and you take a daily B12 supplement to protect your memory, your nerves, and your energy, what I'm about to share with you may genuinely change your life. Because there are two extremely common medications sitting in millions of senior medicine cabinets right now that are quietly canceling out the B12 you are taking, not slowing it down, canceling it out. And the most dangerous part of all is that the symptoms of the resulting deficiency look almost exactly like early dementia, or heart failure, or a stroke. So patients end up being treated for the wrong condition for years before anyone runs the right blood test. Let me tell you about a patient I'll call Helen, 73 years old, retired librarian from outside Cleveland. Her daughter brought her to my office about 10 months ago because Helen had become confused. She was forgetting words mid-sentence. She had stopped driving because she could not remember the route to the grocery store she had been visiting every week for 30 years. She felt tired all the time. Her gait had become unsteady. Her primary care doctor had referred her to a neurologist who had ordered the standard early Alzheimer's workup. The MRI showed mild brain atrophy. The cognitive testing showed mild impairment. The family was beginning to look at memory care facilities. But when I sat down with Helen's chart, I noticed three things that nobody had connected. She had been taking Prilosec daily for acid reflux for 11 years. She had been taking Metformin for type 2 diabetes for 9 years. And nobody had ever ordered a serum B12 level in over a decade. I ordered it that day. Helen's B12 came back at 140 picograms per milliliter. Clinically deficient. We started her on a high-dose Methylcobalamin protocol. Within 4 months, her memory had measurably improved. Within 6 months, she was driving again. Her neurologist canceled the dementia diagnosis. Helen did not have Alzheimer's. She had been silently starved of a single essential vitamin by 2 medications nobody had ever explained to her. I'm Dr. Marcus Okoro. I'm a heart surgeon. And you might be wondering why a cardiologist is making a video about vitamin B12. Here is the answer. B12 is not just a brain vitamin. It is one of the most important cardiovascular vitamins in your entire body. Low B12 raises a substance in your blood called homocysteine, and elevated homocysteine is directly linked to coronary artery disease, stroke, deep vein thrombosis, and heart attack. A 2015 meta-analysis published in the American Journal of Clinical Nutrition examined over 50 studies and found that adults with low B12 had a measurably elevated rate of major cardiovascular events compared to those with normal levels. As a heart surgeon, I have seen the cardiovascular consequences of long-term B12 deficiency. It is not subtle. It does real damage. Today, I'm going to walk you through the 2 specific medications that block B12 absorption and the steps you need to take if you are currently on either one of them. I will also walk you through how to recognize the early signs of B12 deficiency, because they are easy to dismiss as just getting older. Stay with me until the end, because the test you need to ask for is not the standard one most doctors order. There is a more sensitive test, and almost nobody knows about it. Before we begin, I want to be clear about something. I am not telling you to stop any of your medications. Please do not do that without speaking to your prescribing physician. What I am telling you is that you deserve to know what these medications are doing to your B12 status, and you deserve to advocate for the right blood tests and the right supplementation strategy. Medication number 1, proton pump inhibitors. You may know them by brand names like Prilosec, Nexium, Protonix, or Prevacid. These are the most commonly prescribed medications for acid reflux and heartburn. Millions of seniors take them every single day, often for years or even decades. Here's what they do that affects your B12. To absorb B12 from food, your body requires stomach acid. Stomach acid breaks B12 free from the protein it is bound to in food, and only then can your intestines absorb it. Proton pump inhibitors do exactly what their name says. They inhibit the production of stomach acid. They are extremely good at it. And when stomach acid is chronically suppressed, B12 absorption from food drops dramatically. A landmark study published in the Journal of the American Medical Association examined over 25,000 adults and found that long-term users of proton pump inhibitors had a 65% higher rate of B12 deficiency compared to non-users. 65%. And the longer you take the medication, the worse the deficiency becomes. The most cruel part is that the B12 supplement you may be taking every morning to protect yourself is itself bound to a small amount of cofactor that requires stomach acid to release. If you take your B12 with your morning Prilosec, you are essentially canceling out the supplement at the moment of consumption. The fix is twofold. First, talk to your prescribing physician about whether you still need the proton pump inhibitor at all, or whether you can taper to a lower dose or switch to an H2 blocker like famotidine, brand name Pepcid, which has much less impact on B12 absorption. Second, if you must remain on a proton pump inhibitor, switch your B12 supplement to a sublingual methylcobalamin tablet that dissolves under your tongue. Sublingual B12 is absorbed directly through the lining of your mouth into the bloodstream, completely bypassing your stomach and the stomach acid problem entirely. This single change can rescue your B12 status even while you stay on the medication. Medication number 1, Metformin. This is the most commonly prescribed first-line medication for type 2 diabetes worldwide. It is taken daily by tens of millions of older adults, often for 10 or 15 years before anyone connects it to B12 deficiency. Metformin works by reducing the amount of glucose your liver produces and improving your body's response to insulin. It is one of the most effective and inexpensive diabetes medications ever developed. And it has one significant side effect that almost nobody is warned about. It interferes with B12 absorption in the small intestine. The exact mechanism involves calcium-dependent receptors in your ileum, the section of your small intestine that absorbs B12, and metformin disrupts that calcium-dependent uptake. A comprehensive study published in the Journal of Clinical Endocrinology and Metabolism followed over 4,000 adults on long-term metformin and found that 30% had developed clinically meaningful B12 deficiency within 5 years. 30%. And the longer you stayed on the medication, the higher the rate. Here is the cruel irony. The early symptoms of B12 deficiency, fatigue, numbness in the hands and feet, balance problems, memory difficulty, are almost identical to the symptoms of poorly controlled diabetes. So the patient is told their diabetes is getting worse, the metformin dose is increased, and the actual cause, B12 depletion, never gets tested. I want to be clear. Metformin is a powerful, life-saving medication. The solution is not to stop it. The solution is to monitor your B12 level every year and supplement aggressively if you are on long-term metformin. Sublingual methylcobalamin is again the preferred form for the same reason. And there is some evidence that calcium supplementation taken with your metformin may partially restore B12 absorption in the small intestine, although you should discuss this specifically with your physician. Before we get to the next part, let me ask you something. Are you currently on either Prilosec, Nexium, Protonix, or Prevacid for acid reflux? Or are you on metformin for diabetes? Type the medication name in the comments below. I read every single comment, and I want to know how many of you are silently in this position right now. And please hit the like button if this video is opening your eyes. That one tap helps YouTube push it to more seniors who need this information before their next pharmacy refill. Now let me walk you through the early signs of B12 deficiency because most seniors miss them completely. Sign number 1, persistent fatigue that does not improve with rest. B12 is essential for the production of healthy red blood cells. When B12 is low, your red blood cells become large, malformed, and unable to carry oxygen efficiently. Every cell in your body is starved of oxygen, and the dominant feeling is constant tiredness. Sign number 2, numbness or tingling in your hands and feet. B12 is required for the maintenance of the myelin sheath that protects every nerve in your body. When B12 is low, the sheath thins and the nerves begin to misfire. The earliest signal is a pins and needles sensation that starts in your fingers and toes. Sign number 3, balance problems and unsteady walking. The nerves controlling your sense of balance and position in space are particularly sensitive to B12 deficiency. Many seniors who are diagnosed with age-related balance problems actually have B12 deficiency that nobody has tested for. Sign number 4, memory difficulties and word-finding problems. This is the symptom most commonly misdiagnosed as early dementia. Helen, the patient I told you about at the start of this video, had this exact symptom. Sign number 5, a sore or unusually red tongue. This is called glossitis, and it is one of the classic signs of B12 deficiency that most patients have never heard of. The tongue can become smooth, beefy red, and painful. Sign number 6, depression or irritability that came on without obvious cause. B12 is required for the synthesis of mood-regulating neurotransmitters, and deficiency can produce real clinical mood changes. Sign number 7, shortness of breath or palpitations with mild exertion. This is the cardiovascular symptom I mentioned earlier. When red blood cells cannot carry oxygen properly, your heart has to work much harder to compensate, and you feel breathless climbing stairs that used to be effortless. If you have one or two of these signs and you are on either a proton pump inhibitor or metformin, the most important action you can take this week is to schedule a B12 blood test with your physician. And here is where I want to give you the inside medicine tip that almost nobody outside of cardiology and hematology knows. The standard B12 blood test that most doctors order is called a serum B12 level. It tells you how much B12 is circulating in your bloodstream. But here is the problem. Serum B12 can look normal even when your tissues are functionally deficient. Many seniors with significant B12 deficiency are missed by the standard test because their serum level falls within the technically normal range. The more sensitive test you should ask for is called methylmalonic acid, or MMA, When your cells cannot use B12 properly, MMA accumulates in your bloodstream. An elevated MMA level is one of the most reliable early indicators of functional B12 deficiency, often catching it months or even years before the standard B12 test would. If your serum B12 is at the low end of the reference range and you are on either of the medications we discussed, ask your physician specifically for a methylmalonic acid test. The exact words to use: I would like to add a methylmalonic acid test to confirm my B12 status. A good physician will respect that request and add it to your blood panel. Now let me talk about supplementation, because not all B12 supplements are created equal. There are essentially three forms commonly sold. Methylcobalamin is the cheapest and most widely available form. It is what you find in most drugstore vitamins. The problem is that your body has to convert it to the active form, and that conversion is impaired in many older adults. Methylcobalamin is the active form of B12. Your body can use it directly without any conversion. Hydroxycobalamin is another active form, often given as an injection. For most seniors, especially those on proton pump inhibitors or Metformin, methylcobalamin in a sublingual tablet is my preferred recommendation. A typical maintenance dose is 1,000 micrograms taken sublingually once a day. If you are clinically deficient, your physician may recommend a much higher loading dose for the first several months, or even a series of intramuscular injections to restore your levels rapidly. Do not start a high-dose protocol on your own. Work with your doctor. Let me bring this together. If you are taking a B12 supplement to protect your memory, your nerves, your energy, and your cardiovascular health, two extremely common medications can quietly cancel that protection. Proton pump inhibitors for acid reflux and Metformin for diabetes. The fix is not to stop the prescription medications. The fix is to switch your B12 supplement to a sublingual methylcobalamin form that bypasses the absorption problem entirely. To ask your doctor for both a serum B12 and a methylmalonic acid blood test, to know the 7 early signs of deficiency so you can spot them in yourself or someone you love, and to talk honestly with your physician about whether you still need the proton pump inhibitor at all or whether a safer alternative makes sense. Helen, the patient I told you about at the start, did not have Alzheimer's. She had been silently starved of a single essential nutrient for over a decade because nobody had ever connected her 2 medications to her cognitive decline. After 4 months on sublingual methylcobalamin, her memory came back. After 6 months, her gait had stabilized and she was driving again. Her family told me they felt like they had gotten their mother back. That outcome is not unusual when B12 deficiency is the actual cause of cognitive symptoms. It is the rule. And it makes me genuinely angry that so many patients are misdiagnosed for years before anyone runs the right test. Here is what I want you to do this week, just one thing. If you take either a daily proton pump inhibitor or Metformin, please call your doctor's office today and ask for a B12 and a methylmalonic acid blood test. Use the exact phrase: I would like to check both my serum B12 and my methylmalonic acid level. That single test could change everything you understand about your own health. If this video helped you, please do 2 things for me. First, share it on Facebook right now and tag one person you love who is over 60 and on long-term acid reflux or diabetes medication. You may be giving them the most important conversation they have with their doctor this year. Second, please subscribe to this channel. I post a new video every week with the kind of honest, evidence-based health information I share with my own cardiac patients. A final note: everything I shared today is general health education based on published medical research from JAMA, the Journal of Clinical Endocrinology and Metabolism, and the American Journal of Clinical Nutrition. It is not a substitute for personal medical advice. Never stop or change any prescription medication based on a YouTube video. If you take Metformin for diabetes or a proton pump inhibitor for acid reflux, do not discontinue them without your physician's guidance. Discuss B12 supplementation and the methylmalonic acid test with your own doctor before making changes. I am Dr. Marcus Okoro. Take care of those vessels and that B12. I will see you in the next video.